Hi, my name is Wesley Parks. I did my project on health information exchanges. Today I'm going to tell you a little bit about them. What is a health information exchange? It is an electronic health information exchange that allows doctors, nurses, pharmacists, and other healthcare providers and patients to appropriately access and securely share a patient's vital medical information electronically. And what that does is it improves the speed, quality, safety, and cost of patient care. All right. In the past, health informatics exchange efforts were established about 20 years ago. The Community Health Management Information System was formed to foster the creation of a centralized data repository in 7 communities, I believe it was. Most communities struggled to secure cost-effective technology, stakeholder trust, and strong political support when this first happened, so it didn't really gain too much ground. Then in 1999, it gained additional support following the Institute of Medicine report To Err is Human, which identified medical errors as a significant threat to the health of Americans that could be fixed. And due to that, a new generation of federal efforts emerged to address these concerns, and in part through the effective use of information technology. After that, the federal government gave out millions in grants. In 2004, the Agency for Healthcare Quality and Research, AHRQ, funded $166 million in grants and contracts to improve healthcare decision making, support patient centered care, and to improve quality and safety. All this was just kind of done in an effort to kind of actually fund it and get it off the ground and actually make people start developing it, or not make, but give them a reason to. Another effort that took place was the Medicare Modernization Act of 2003. What it did was it authorized AHRQ and the Centers for Medicare and Medicaid Services to award $6 million in grants to 5 states to test initial standards for electronic prescribing, see how efficiently and effectively prescriptions for Medicare Part D beneficiaries could be transmitted electronically. And currently today, there's 3 different forms of health informatics exchanges currently in use. The first is directed exchange. It is the ability to send and receive secure information electronically between care providers to support coordinated care. And what that means is a primary care provider can directly send a patient's health record summaries that include medications, problems, and lab results to a specialist when referring the patient. That way, it'll keep the patient from having to have duplicate tests, redundant collection of information from the patient, wasted visits, and medication errors. The second type is query-based exchange. It is the ability for providers to find and/or request information on a patient from other providers, often used for unplanned care. And that goes back to like the emergency rooms. If like a patient comes in and allows the physicians to utilize this query-based exchange to access patient information, such as like medication, recent radiology images, and maybe even problems that the patient might have, and that allows them to better treat the patient and to avoid adverse medication reactions or duplicative testing. Also, if like a pregnant woman was to go to the hospital, it allows the hospital to obtain all of her information with her pregnancy, allowing them to make the decisions about the care of the patient and her unborn baby a lot better. And the third is consumer-mediated exchange. It's the ability for patients to aggregate and control the use of their health information among providers. And that just means like the patient's in control of their own data now. They can actually manage their information, change billing information, track and monitor their own health, identifying correct, wrong, or missing health information. And lastly is the future of the HIEs. The big thing right now is seeing if it'll go into the private sector. Although information exchanges have received millions in funding from the government, there is a chance that the future of health information exchanges is in the private sector. It is predicted that as few as 10 of the currently functioning public exchanges will not maintain operations by 2017 unless they make major changes. Insurers indicated that public health information exchanges are having a hard time exchanging trusted patient data sets, and payers, hospitals, and physicians think majority of health information exchanges fail to provide meaningful connectivity.